and action. Dave had a question about tinnitus. Tinnitus is essentially ringing in the ears. And it becomes, if it's temporary, you can probably get by, hopefully a week or 2 weeks after the trauma. Usually it's gunshot, a firework explosion, loud concert. Sometimes it can be post-ear infection or upper respiratory tract infection as well. Some people will hear it as a ringing or a buzzing. Some people will hear it as a thumping, almost like they're thinking they're hearing their pulse when it's not their pulse. So either way, Western medicine has limited success with treatment. When you go to your primary care doc and you complain about this thing, it's important for us to make sure there's nothing else going on. So you should get a hearing test, and depending on the symptoms, we should check you for wax, check you for an infection, and or if there's a balance disorder, maybe an MRI or a CT scan of the brain. So those hearing tests are done by the audiologist or by the ENT doctor, the otolaryngologist. Once we get the team together to make sure that you're not suffering from anything in particular, then we go with treatment. The treatment, Western medicine-wise, is a little limited. It essentially consists of a masking device. That's almost like a hearing aid, but it's tuned in to the frequency that you're having of the ringing, and it kind of accelerates or neutralizes that sound, that cycles per second, compared to all other in the frequency of what humans can hear. If you've ever seen people wear headsets that are just noise cancellation in planes, it takes the frequency of the vibrations that you hear from a jet engine, and it kind of turns that down, turning on the others, and you essentially mask or you camouflage that one sound of the jet engine. Well, if you suffer from tinnitus at a certain frequency, you cancel that frequency by bringing everything else up. So that's one thing, but insurance usually doesn't cover a masking device. And some people don't like wearing the things because you can tell from the outside that you're wearing a hearing aid, or it looks like you're wearing a hearing aid. They're clever presentations, almost like cell phone accessories, but again, if you could afford it. I think there are some otolaryngologists who try to get their patients into therapy. Very expensive, and I haven't seen any great randomized controlled trials about outcomes for the general population. And again, the theory of why it's caused is a little limited. First, it's thought that there's problems with the bones in the ear, and then it's maybe the muscles controlling the bones, maybe it's the nerves that take the information from the signals that come from the ear. It's a little limited, and it might be a little frustrating to the clinician and to the patient as far as how to take care of this. So that's the extent of Western medicine. There's also complementary alternative medicine, and I believe that's where complementary alternative excels. So I would usually have a chiropractor or a craniosacral massage therapist work on my patients. Some chiropractors are very good at it. Some chiropractors are not so good at it. So you have to find or seek out the chiropractor or the craniosacral massage therapist that is well versed with tinnitus. There's nerves in the neck, and sometimes when the neck is spasmed up or tense, and that's what America is, overworked, understretched, and overtensed. Sometimes if you get to relax these muscles, it might decrease the tinnitus. And sometimes the concept is that the muscles of the jaw, TMJ, can affect tinnitus. Stress can affect tinnitus, and that's why relaxing exercise, things to calm down anxiety might help in the Western medicine paradigm. Well, definitely in the complementary world as far as chiropractic manipulation or massage therapy. So I would always take advantage, but always seek out and ask if they are trained in this. Homeopathic medicines do help as well. The information is a little limited. I don't think the homeopathy world has as many funds as National Institute of Health in putting $1 million into a randomized controlled trial. But again, risk versus benefits, there is very little harm with using massage, chiropractic, or homeopathy. If I was to use the homeopathic pellets specifically for tinnitus, I would do it for about 4 to 12 weeks. Depending on what the homeopathic doctor finds, they might give you a wide range of different homeopathic pellets. I've seen people use Chininum sulfuricum to China officinalis or China boliviana. And the names aren't that important. It's really up to the homeopathic doctor that's seeing you to make the choices. And again, it depends on questions and answers and looking for other associated symptoms. You might not have the symptoms, but it's up to the doctor or the interviewer to kind of elicit them and make the proper choice. I would not go to Whole Foods or Fruitful Yield on your own to just kind of go down the line and see which one works. Homeopathic medicines or pellets, even though they're benign, really, if you're going to be doing something like that, you really should get the help of somebody who's been trained. So that's one option in the homeopathic world. There's also acupuncture. I think that traditional Chinese medicine has been a totally different venue than Western medicine as far as the approach for treating. Usually the treatment for traditional Chinese medicine, the most popular treatment that we know of is acupuncture, but they also use herbs, they also use Tui Na or hands-on healing, and then other things as far as food. It's a whole system approach to taking care of things. The Western medicine approach has been kind of isolate the symptom, treat the symptom only with what you might feel is the cure. The traditional Chinese medicine approach is to treat the whole person. That would find the root cause and then reverse it. The quick way to do it would be acupuncture. And acupuncture is a 5,000-year-old tradition that uses meridians based on the same context or the same mapping out of the human body as 5,000 years ago. So the meridia and the acupuncture points are about the same as 5,000 years ago. The needling system is the same. Electricity versus non-electricity depends on the practitioner, but there have been some very nice results in some very limited studies on the use of acupuncture with tinnitus. It's always a matter of weighing risk versus benefit, and since there is no downside to acupuncture, just like any complementary alternative medicine, then it might be worth it. The only problem is getting it paid for. So the likelihood of any side effects, unless you're pregnant or unless you have a bleeding disorder, are low. Acupuncture doesn't work that well in kids because the meridians are a little different and there's a lot of energy that's involved with that. So again, it's up to the practitioner. I would always seek out a Chinese trained doctor. I think they have grown up with acupuncture, they grow up with a concept, so they have probably the best outcomes. The doctors that are trained here, and I took the UCLA course for physicians, I think we're very good, but I would still seek out the training of somebody that's very deep in their philosophy and it resonates with them every day. So those are the best results that I've seen with the use of standard and complementary alternative approach. I don't think that there are any great results with herbal treatment. Certainly, again, if the associated symptoms in Western medicine are worsened by high blood pressure, anxiety, frustration, and stress, you always want to bring those things down, and there's a whole other lecture there that I can talk about with making life well balanced. But understanding all that, just a treatment plan, hopefully this maps out and gives you a little bit of an approach of, or at least some direction. It's going to be very limited, Dave, as far as who and where you can find people in your area, but seek them out. Don't just tolerate the symptoms, and by all means, use ear protection if you're going to be exposed to anything with loud impacts.